Congestive heart failure, the inability of the heart to keep up with the demands on it, and failure of the heart to pump blood with normal efficiency. Nearly 5 million Americans are currently living with this disease and the symptoms associated with it, including shortness of breath, asthma, pooling of blood in the general body circulation, or even enlargement of the heart. Join us today as we discuss how patients with advanced heart failure can benefit from St. Francis Hospital, the Heart Center's Ventricular Assist Device program, the first hospital in Nassau County to offer this service, on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone, and thanks so much for joining us. I'm Jane Hansen. St. Francis Hospital launched the first left ventricular assist device, or LVAD, program in Nassau County in 2015. This new therapy offers patients with end-stage heart failure a new lease on life. It can be used as a bridge therapy to stabilize heart patients while they wait for a heart transplant, but it's also become a longer-lasting therapy for those who don't qualify for a transplant because of their age or medical factors. Joining us now is Dr. Edward Lunday, a cardiothoracic surgeon and surgical director of the program, and Jamie McDermott, its administrative director. Thanks so much for being with us, to both of you.
Thank you for having us.
So you recently had a wonderful story about the first patient to receive this life-saving device at St. Francis. He was able to celebrate his 55th birthday at the hospital while he was recuperating from the procedure and is now awaiting a heart transplant. So let's all take a look at this video before we talk more about this amazing procedure.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Harvey and Jessica.
We had no clue that he was sick. He was a healthy guy, no drinking, no smoking, but worked out all his life. He got sick with a cold. And then we came back home. Antibiotics didn't help. He was still sick. And all of a sudden, his legs started getting very swollen. So we went to his medical doctor. He goes, uh-oh, something's wrong. And he had a stroke on the train on the way from work. Then they said, we give you 5 years. That was the hardest news you could get at that time. You only have 5 years, and that's hard. He's 53. What do you mean 5 years? Oh. So we went from everywhere, and then at one point I said, Erica, you work in St. Francis. I know you see all these doctors there. Find out to see if they have a congestive heart group, and she did.
I was just finishing nursing school. I was just getting a job here, and so my dad was showing signs of heart failure, the fluid retention, the shortness of breath, and he was a very active guy before he got diagnosed, so it was it was sad to see him decline so fast.
I asked him where he was from. He said South America, and I said, have you ever been checked for this particular disease, Chagas disease? In a young person that has a cardiomyopathy of unexplained origin, you always have to think of this particular disease because it's endemic to that continent. It's transmitted through a bite of a bug, which contains the parasite. Although the name of the bug is called the kissing bug, it's not transmitted by kissing. It can be transmitted from people to people by blood transfusion. It causes a cardiomyopathy, which is often unrecognized, like what happened to him. If it's recognized early, there are antifungal agents or anti-parasitic agents that can treat the underlying infection by a good clinician who knows what they're doing, and they can treat it and eradicate it quickly. It's not endemic, at least to the United States, although there is penetration into the southern United States, but there's now more of an awareness going on because there's about 300,000 cases. If left undiagnosed, it causes a cardiomyopathy, and then patients present with heart failure later on in life.
The damage to the heart is already done, and the heart slowly deteriorates, and then usually right around this time in life, The heart is so weakened from the parasite and the disease that it can't pump the blood.
They informed us of what his future would look like. And one of the options was an LVAD.
This is an actual LVAD, okay? This is actually the device we planted in Javier. And literally this is a pump with a spinning rotator inside it. And we actually surgically implant this part in the left ventricle of the heart. And then we connect this part to the aorta. So you literally bypass the left side of the heart. And then this cord comes out of the skin, and that's where you connect the batteries to it. So the pump literally spins, sucks the blood out of the left side of the heart, and then pumps it into the aorta, thereby giving someone blood flow that they didn't have before. Javier, he was on death's doorstep. He was pale, he was white. I think you heard his wife say many times how much color he's got. He looked terrible, and then to see him now look that good, watching him today outside, and he commented to me that the trees were blooming, okay, as we went by the trees, which was pretty cool.
I could do more things now. So I'm gonna go home and do some stuff.
Happy birthday to you.
Are you gonna blow the candles?
That is absolutely amazing, and we're going to be privileged enough to have Javier and his wife here with us in just a little bit on this program. But I have to tell you, how did this all come about? Because it had to take a very long time to get this procedure approved and to actually know that it was going to work. I'm just astonished by its ability.
We started working over a year ago, building a team, taking that team actually to the University of Michigan for intensive multi-day extra training and establishing frequent meetings. Protocols were put in place. As I said, Jamie worked tirelessly for almost an entire year to set all the pieces in place so that, and we also, before we did our first and did Javier, we had done mock trials multiple times and gone through every step of the process, so we were ready for it.
Well, this is it. And it just seems amazing to me that that's actually implanted into the heart and the body.
Correct. We actually implant, this goes in the heart, and we implant this just outside the abdominal cavity, and inside here is a spinning rotor that literally sucks the blood out of the heart and then pumps it into the outflow cannula, which we sew into the aorta. So it literally bypasses the heart that's not functioning well and pumps the blood for the heart that's failing. Everyone asks, what's the cord? The cord comes out of the skin, and the cord is what hooks to the batteries. This is a battery-powered device.
And Jamie, you've just been credit for having worked so hard to bring this program to fruition. But what do you tell patients? Because they have a lot of precautions they have to live with.
Absolutely. So the first thing is that it runs by power, and power is the most important thing. When patients are walking around, they actually wear 2 batteries that will power their device. The other major thing is that because it is a device, it cannot get wet. Patients are not allowed to swim, and they actually have to be very careful even when they bathe.
There are patients who are living, I mean, I know this is, in Javier's case, it is waiting for a transplant, and that will be the case with many people, but they actually can live with it for the rest of their life, right?
There are multiple patients that have had this device and lived longer than 13 years with that device. So this device can be used when someone's not going to get a transplant, but just as a life-saving device, and people can live many years with an excellent quality of life with just this device.
And what's the survival rate once somebody actually has a heart transplant?
In the first year, it's greater than 95%.
95%?
Most institutions now, the results are very good with the heart transplant in the first years.
But to get eligible for a heart transplant, I mean, that would have been one of the issues with Javier, right? He wasn't until you put this device in him?
Well, it takes a long time to get a heart transplant in the United States. The average is somewhere between 6 and 18 months, depending on blood types. And Javier, as you will see, was dying. Okay, he was literally dying. He could not get out of the chair. He couldn't really walk at all. And if he was waited 6 more months, he would have been dead. So what we did is put the device in him, and now you'll see he's up running around, doing everything he wants, and he's being listed for a transplant.
And this must be really wonderful to see, Jamie, to give this kind of hope to people.
It really is. It's really wonderful to see him be able to spend time with his family, and he's able to do the things that he wasn't able to do when he was really sick. Prior to having the LVAD, he was basically confined to a couch. Now he's able to drive, he's able to exercise if he wants, he can run around with his grandchildren. I encourage people to go back to work, travel. Really, you can do anything.
The quality of life is just immensely improved.
And I had said to you earlier, his wife said something that before the device was put in, whenever she kissed him, his lips were ice cold. Okay, his blood flow was so poor that he was cold. And after the device went in, she said, "Oh my God, when I kiss him now, his lips are warm," which I think sums up a lot.
Makes me want to cry. Isn't that wonderful? Doesn't it bring tears to your eyes?
That made us feel pretty good.
Is this the evolution of the original, from the first heart transplant to today, to have this kind of device?
This has been going on since the 80s, and it's actually been going on longer than that. People have been trying to devise artificial hearts. I think we all remember Barney Clark a long time ago. And this is kind of where it's come to. It's been a slow and steady progress with improvements in technology. This device is a very good device now that lasts a long time and functions very well.
I've got to believe it's pretty expensive.
It is fairly expensive.
So well, how does that go into the consideration? I mean, obviously heart transplants themselves are obviously quite expensive.
We don't usually focus on the money, the price too much. It's more the people. One of the things that's very important is people need a very strong social structure around them for this device. They need to have family. They need to be able to handle the device. That's something we worked very diligently at before to prove that they can handle all the things.
How remarkable that Erica, his daughter, was actually a nurse at the hospital, because she can, if she can certainly be around to help him with this.
Absolutely, and she has been around to really help him with the device after the surgery.
What did she tell you afterwards?
Wow. She was just so happy that we were able to offer this device to her father.
That's a remarkable story, and we're going to meet him in just a minute. First, though, we're going to take a quick break. And when we come back, we will be joined by Nassau County's first LVAD patient, Javier, and his wife, Jessica, to tell their story about this amazing procedure. Welcome back to CHS Presents Lifestyles at the Heart of Health. The typical wait time to receive a heart transplant can be anywhere from 6 to 18 months. During this wait time, St. Francis Hospital, the Heart Center, can provide patients with prolonged survival and a better quality of life by implanting a left ventricular assist device, or LVAD. Joining me now with the first Nassau County recipient of this life-saving device is Javier Valencia and his wife, Jessica. Welcome to both of you. You look great.
Thank you.
How do you feel?
No, I feel good. I mean, I feel a lot better with the transplant and everything. But yeah, I'm able to do a lot of stuff. I mean, I'm able to fix things around the house and around the pool, you know, things. So I feel a lot better.
And you can actually walk for long distances?
Yeah,
I mean,
I could walk. I could, you know, go up the steps and not get tired. Before, I used to get tired before, but not anymore.
Well, Dr. Lundy told me that you could barely bend over to tie your shoes without being breathless.
Yeah, before I was not able to, you know, bend down, tie my shoes, you know. I wasn't able to do that. But now it's I could. I mean, I don't know.
Jessica, it must have been awful what you went through in the couple of years leading up to this.
I mean, I know him since I was 14, and he's always been on the go, you know, always working out. And to see him deteriorate, it was heartbreaking.
And you kept asking for help and answers?
I'm a person that I would not stop. You know, a diagnosis to me, it's a avenue to find out why. And I want to know why. He didn't drink, he didn't use drugs. I just needed to know why. He had no family history. And they told me there was no way to find out now. The only time they could do is a heart biopsy, and it was that was after the fact. And when they told me that, I just said, I am not going to stop. So that's when I actually went and said, Erica, you need to get me someone that, you know, another congestive heart failure group. I wanted a second opinion, and we did. And it was like, you know, I'm a big believer of prayers, and God answered my prayer.
It's almost like fate that your daughter was a nurse.
Yeah, and she told me, Mom, I seen this every day, so I know what the outcome is.
Ooh.
So between me and her, we suffer not telling him, because I think, you know, we want to keep his spirits up.
So when they told you about this LVAD device, did you think, oh, of course, right away, or were you worried, or did you have doubts about what would happen with it?
No, I was, I mean, I look at the device and I said to myself, I said, I mean, the device must work and everything. So, I mean, if I was to do it, I'll give it a shot, see if I get better. And, you know, I did get better.
So you've got a little battery pack on you, which you're wearing right now.
Yeah.
And you've got a little, can we, would you mind? Like,
Yeah, you can
that's
see it.
where the,
The
so that's
station
the cord that the doctor just showed us that comes out.
That's a
of,
drive
Yeah.
line.
yeah, okay. And that's what's hooked up to the battery.
Yeah, that's what's hooked up to these batteries right here, you know.
Right. You're like a super energizer bunny, I think, walking around with this. Does it become uncomfortable? I mean, I'm just...
No, it's not uncomfortable. I mean, you get used to it. I mean, it's just getting used to it. So, I mean, in the morning when I get up, I just hook it up, you know, hook up the batteries and just go on and do anything would have to do.
And you have to be charged all the time.
Yeah.
Constantly charged. You guys have a couple of grandkids now. You're actually able to play with them and do things with them. I mean, and I know one of them's a baby, so it must have been hard to think, I might not be around for these guys if I don't do something like this.
Yeah, that's what I was saying before, you know, but I was, you know, praying hopefully and everything, so God really keeps me around. So, I mean, it was good. I mean, I'm able to play with my grandson and granddaughter, so.
You're on the, now you're about to be on the transplant list, which will be another big step. That you will have a heart transplant ultimately when one becomes available. Does that process, I mean, how do you feel about that going forward?
I mean, I look forward for that because that's basically what I really want, really. So, I mean, once I get that, I mean, then I just take my medication accordingly, whatever.
I think once you go through this, I think the transplant is it's the same, basically the same thing. You're just trading one set of situation for another. You know, you don't have the daily care, and the only thing you have to pick up is your medication on time. You have to make sure because the anti-rejection medication.
Oh, sure.
But you know, I think you know this is a lifesaver though, because at least he's able to be at home and able to move around. We don't have to leave him behind, be scared if he's gonna wake up. It's the uncertainty. It's you don't sleep. I don't think I slept for 3 years.
Oh.
Not.
Oh. And how could you, I mean, how can you live your life when you're going through something like that?
You can't.
And then you have to keep, like you said, you had to show him that you weren't
Yeah,
worried.
afraid. And, right. We had to show that we were in the worry. It's just, I think I aged. So.
Well, now you can unage
Oh.
because
Now I'm going on vacation. We are planning vacation because you could travel. I mean, it's so much. I just seeing him like this.
well, it's always hard to be the first at something. So you're the first one. I know that the LVAD had already had proven success elsewhere, but it's the first time it was being done here. So to take that step and be kind of a little bit of a guinea pig, did that concern you at all, or was it just right into it because you knew how good the hospital is?
Yeah.
You know, I think Jamie, the process that she is so easy for her. I mean, she's a godsend. I mean, she made it easy for us to understand it. The video that they showed was so self-explanatory, and when she was teaching us, it made it look like, okay, we could do this. You know, and I think it's all the part of it. She's so positive about it, and she's a drill sergeant. I'm telling you, she's a drill sergeant. It's this and this. You make sure and testing us. I mean, we went through a lot of before this. Yeah. We went a lot of training with her.
Well, I heard you're a bit of a drill sergeant about it too. So, right? Is she?
Yes.
So, what do you? Do you have any idea when the heart transplant might take place or how long it's going to be?
They explain it to us. I mean, you know, with his heart type, it's a little harder. You know, New York is hard because, you know, it's 3 hospitals competing. Not many people donate, you know. There's a lot that goes into it, but, you know, at least we could wait without worrying.
Right, exactly.
Because that was the biggest worry. I mean, he was in the hospital a lot, and we saw the decline. His eyes were not the same. Now you see the brightness. He has color. His lip is now purple. His hand, it's just so much. It's such a big change that, you know, sometimes I say, oh my God, don't. Just
He's back.
He's back, yeah, and he's running around. Now I'm like, wait a minute.
He's got that extra battery power, so you have to keep up.
I'll keep up. Last time he walked, I went 1.5 miles, and I was worried. I was about to call the police.
Because you thought he was lost?
I said something happened to him. But this is because he feels so much better that he kept going and going and going. It's
Yeah,
like
I
the
went
Energizer Bunny.
Yeah.
Went to my mother's house and everything. She
But
lived
I
about
didn't
1.5
know.
miles away.
Well, it's great to see you in such great spirits and to feel so good. Stick around. We're going to take a quick break. We'll continue our discussion right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. It has been a pleasure meeting all of our guests today. Javier and Jessica, of course, you are the first Nassau County recipient of the LVAD, and we've got Dr. Lundy, who is the doc, and we've got the drill sergeant over here, Jamie McDermott, who is the administrative director from St. Francis Hospital, the Heart Center's new LVAD program. The 4 of you, watching you bond here, this has been a real, it's been a real journey for all of you. Can you describe that for me, Jessica?
It's a family for me. I can never thank him enough. You don't know, it's just, words cannot describe the gratitude that I have for him and for her, because she's, no matter how many times I call her, it was never like, it was, how can I help you? And that makes me feel more comfortable, because I know that at the end of the line, if I have a question or anything, I will get answered. And I can't thank him enough. How can you thank someone that saved your husband?
I have no idea, because that is
I
the
just
most
can't.
remarkable experience that I think any human being can have.
Yeah.
When she says that, how does it make you feel?
It chokes you up. And then this has been a process. I met Javier many, many weeks before we did, and as I said, he looked terrible. Okay, he was white. You've said his color is back, and to see him now and to see the 2 of them now is just all the things I need.
And Jamie, you worked on this program for so long before this surgery actually happened. Did you dream about this kind of day when you'd see a patient with this success?
Absolutely. This is more than I could have asked for of what I wanted for this program, and Javier was the perfect patient, and Jessica's the perfect caregiver, so it's really rewarding for me.
She kind of listens sometimes.
She does.
To her, I do.
Well, and she's described that this process now of making sure that they follow what you're telling them, and every day, because you feel so good, it's got to be hard some days not to, to almost remember what you got going on, isn't it?
Yeah, it is. I mean,
But he has his drill sergeant here. Keeping him in line.
yeah, I feel a lot better now. I mean, now with this procedure, I feel a lot better. So I could do anything really.
So what did you say the first time you saw Dr. Lundy after the surgery? What did you say to him about this?
Yeah, I said, thank you for giving me a second life. And for, making me feel good now.
Well, it's a revolutionary process or an evolutionary process that will go on to probably save many more lives. So for being the first, congratulations at where you are right now. It's such a pleasure to see you looking so good. And what do you say to your grandkids and your children?
What am I going to say to them?
No, to the grandkids and your own children.
Yeah, I know I'm going to tell them, I'm still here, I'm still around, and I'm able to play with them, So, that's real good.
And what more could you want in life? And there are other people coming.
Yes.
I know you will be doing more of these, and we would love to meet all of them as well. So congratulations to all of you.
Thank you.
How about a group hug or something? Come on. Thanks to all of you for being with us today, and thank you for watching. And once again, for patients, family, and referrals from clinicians, please call 631-689-3330 for access to 24/7 service at St. Francis Hospital. And as always, for more information or to schedule an appointment with Catholic Health Services, simply call 1-855-CHS-4500 or visit chsli.org. Thank you for joining us today. I'm Jane Hansen, wishing you goodbye and good health.